Thank you. Terry, we'd love to hear from you as well about what's happening in the hospital sector and how you provide training to your workforce and what type of skills you think the healthcare sector will be looking for in the years to come.
Thanks, Heidi. And first of all, thank you very much for including me on the panel as a on-the-ground employer living this life. It can be very challenging, but it's also encouraging to know that there are people that are doing the research and the policies and that sort of thing that are going to be there hopefully to partner with us and to help us as employers. If I could first, I want to set the stage a little bit for why there's going to be such a demand of healthcare workers and very different types of healthcare workers. I know you're all familiar with the Affordable Care Act and healthcare reform. In the healthcare field, we believe that reform was taking place and would be taking place regardless of where you feel the Affordable Care Act is going to help. Certainly, it is designed to make sure that over 30 million Americans have access to insurance. But there are a number of other factors that have been contributing to increased demand for medical care. Baby boomers, about 10,000 a day, are retiring. The fastest growing segment of our population are the frail and elderly, those people over age 85 who have multiple and significant chronic conditions. So there are a number of demographic changes that are going on. Also, there are demands on the healthcare sector related to IT. We're very far behind, nowhere near where airlines and banking and many other fields and sectors have been able to move towards with information technology. Specifically for us, it's electronic health records, trying to computerize what we've been doing on paper for many, many years with a healthcare workforce, particularly in a hospital that often the average age is 45, 50 and above, who really is not too keen on doing something differently with computers than they have for the last 20 or 30 years. Billing and coding is about to become much more complex. Right now, there's a DRG system. There's about 500 or so codes for an inpatient stay that you provide for Medicare and also for commercial billing purposes. ICD-10, it has been delayed again for a year. The 10 stands for 2010, which is when we were supposed to implement it. But I believe it will go into effect in the next year, so I don't believe that extension will occur again. Just to put that in perspective, ICD-10 will change procedure codes from 4,000 currently to 87,000 codes. The digits will go from 3 to 4 in length to an alphanumeric 7 characters in length. The diagnosis codes move from 14,000 to 68,000 codes, going from 3 to 7 characters. So the information that can be extracted through IT, coding, and billing is going to be wonderful for us to be able to improve health, track patients, make sure there's just a whole host of reasons. But it's also going to require billing and coding professionals that are much more skilled than they have been in the past. Also, the frontline healthcare workers, the speaker last night alluded a little bit to this. I couldn't agree more. The fastest growing segment of the healthcare workforce are personal and home care attendants. It is expected between now and 2020, the demand will be about 7% annual increase. Same thing for home health aides. That's the third largest occupation in terms of demand and growth expectations. Now, there's some new federal legislation that will take effect in January of 2015 related to the Fair Labor Standards Act, which will help minimum wage and overtime payments to these home care aides and healthcare workers who have been underpaid significantly, but that also puts pressure on the organizations that are trying to provide these services. What these frontline workers are also going to need in exchange for those minimum wage increases and better working conditions are the ability to use technology. They also are going to need to be able to monitor a diverse set of data streams. They will no longer just simply provide baths and personal care assistance to people in their homes like many domestic workers have historically been able to do. There's going to be a lot higher expectation of them, and they're going to have some minimal skill set. They're also going to be expected and need to be able to detect patterns in changes in patterns for the people that are under their care, mood changes, behavioral changes, just changes in their routine. So there's going to be more of a reliance on them to assist that next level of healthcare worker, which may be a home care nurse or a physician or an advanced nurse practitioner. HIT, health information technology, is a huge component of the healthcare, particularly hospital growth in workers. In my organization, that department has grown faster than any other department in our hospital, and it's probably tripled to quadrupled in the last 10 years. And we always have a number of vacancies looking for skilled workers. What we need is no longer the computer guy. That's what we still call a few of them that come to our personal desk to help us with minor problems, but we're looking for people that can integrate internal IT infrastructure with external networks and personal health technologies. So people are going to be expected to maintain their own personal health records so it can be comprehensive. There are already websites that allow patients to do that because hospitals only know about the health care that was provided in their facility. Physicians only know about the health care provided in their facilities. If a patient is going to multiple doctors, there's not a place for all of that to reside, and so we're going to rely on the patients to do that. We also need privacy specialists because that is HIPAA, of course, is a huge issue in health IT and in hospitals, and clinical decision support technicians and technologists related to computer specialization. We believe in the next 4 years, just in Louisiana, there will be 3.8% annual growth for network systems analysts. Then getting into the real at the bedside health type professionals, there are allied health professionals that are severely a shortage of currently, and this is nationwide. These are not just Louisiana statistics. Physician assistants, in Louisiana there's only 3 programs. We estimate we need about 12.4% more each year for the next decade. Physical therapists and physical therapy assistants, same sorts of annual demand increases. Pharmacists and pharmacy techs. So if you're detecting a pattern here, we need the skilled, the highly skilled worker, but we also need the technician or the skilled worker extender, because what we're trying to do, because of the shortages in many of these areas, we're trying to make sure that our specialists and our highly educated and credentialed employees are working at the top of their licenses, and anything they're doing that can be provided by someone else that doesn't need to have that level of licensing or credentials or education, we're trying to push that down to a lower level, and that's why we're creating such a demand for assistants and technicians. Now on to the 2 big ones, nurses and physicians. Nurses currently in Louisiana, there's an annual need of 1,170 registered nurses between now and 2020, and in Mississippi it's 1,200, Alabama 2,000, South Carolina 1,600. So you can see the demand for registered nurses is going to continue to grow. There's a couple of problems that we anticipate that are going to exacerbate this. One thing is that over half of the nurses that are working are 40 years or older. So we continue to see an aging of the nurses that are working in hospitals and direct patient care, and as a result, we feel like the demand is going to increase even greater. There's also a limit on the number of slots in nursing schools. So it's required that you have a pretty good GPA and ACT and SAT scores to get into nursing school. And when we are not able to provide the number at the RN level, then we're going to have to look elsewhere and create new positions to assist the RN so that she's doing those things that only RNs can do. Advanced nurse practitioners are also another way to help with the physician shortage. And on the physician shortage, it's primarily, I think, as we all know, in primary care and in rural areas. Physicians are not interested really in going into primary care because the pay is so much lower. And they're not interested in going into rural areas because often they don't have the ability to share call, and the payer mix is really poor. It's primarily Medicare and Medicaid patients, and those government payers do not pay enough for a physician to be able to maintain a practice. So there are a lot of factors that are contributing to the limits on what we're able to do as the healthcare field, and we see the demand there. We know that it's going to be a growing field, and the demand is going to continue to grow, not only because of the medical care that's going to be sought and the patient demographics, but also the need for highly experienced healthcare workers that are able to fill in some of these gaps.
And if you have examples of effective models out there, we'd love to hear about that as well. And Mark, I'll go ahead and start with you, or Laura, it's fine.
Why don't you go first? You're the practitioner. Really, the National Fund for Workforce Solution has given us an incredible model to do the cluster work, as I had said a little bit earlier. And, you know, I think it started with Saudi C structure, the way that we're structured as an industry-driven council with all of our workforce development partners at the table. When we drill down on our clusters, with our 4 clusters, they actually are in 4 stages of their own maturity. You know, I mean, it really depends a lot on the employers themselves. You know, we have a very active maritime cluster, largely because the demand is so great. You know, at any given point in time, we do a lot of real-time demand analysis. You know, we get our arms around the demand on a monthly, quarterly basis, and the need for skilled workers in maritime is just astounding for our. So, you know, within that cluster, at the table, we have our top employers. We have our training providers, Alabama Industrial Development Training, as well as Alabama Technology Network, which are part of our state system. AIDT in particular really focuses on very large expansions and as well as new industry coming in. They've got a great you know, reputation in the state as well as nationally. We also have our K through 12 folks at the table as well. You know, it gets challenging sometimes. We don't just do our cluster work on a quarterly basis. We do have quarterly meetings. A lot of it's one-on-one and daily, whether it's working with the providers or working with the employers as well. But our organization really serves to facilitate that. You know, very early on when we established our aviation cluster, and this is actually a new cluster for us this year. We essentially, you know, the very first question we asked our employers are, you know, what is keeping you up at night? And they literally gave us, you know, sort of 3 top priorities for the aviation cluster. And again, all of these folks, Alabama Career Center, community colleges, K through 12, 4-year systems, sitting at the table, listening to the employers. And then our organization serves to facilitate the various partners in the solutions to the employer's needs. Some of those can be short-term. In other words, we facilitated incumbent worker training with our community colleges. The one thing I love about the National Fund, you know, model is it requires, you know, a very disciplined way of aligning dollars. So for every dollar that we put in, we have to match it with another dollar and then align another 3. And we made the decision as an organization to do that with every one of the training programs that we facilitated. So we make sure everybody's got skin in the game. And when the employer sees that you're facilitating this and you're leveraging the resources, they don't have any problem whatsoever putting skin in the game. So, and the value proposition for the employer is something that we're very sensitive to make sure that we are responding to, because at the end of the day, and I always ask this to my employers in particular, is you know, was this of value to you? And that's what's going to keep them coming back in this cluster work. So as long as they're seeing value to that cluster work. I didn't talk a lot from the participant side. That was more from the employer side, but that model's been tremendous for us.
So let me add 2 things that may seem in the beginning counterintuitive that I think I've picked up around along the way. One is whoever's been involved in program evaluation, assessment, evaluation. Could you raise your hands for a minute? Could you cover your ears for a minute? ROI. All those folks who raise their hand give us ROI to 0.1% just to show us they have a sense of humor, because the data doesn't support evaluation very well. The real data that we want is almost never accessible in the form that we want. And even if we could get the better data, I really question why we don't ever put a value on the time of the people who were engaged in getting the training. Because if we're actually thinking about this from who's got skin in the game, the dollar amount is never there for the people who have the biggest amount of skin in the game. So let me just say about ROI. My experience with employers is you can go to them and you can say, I have a great ROI for my, and there are stakeholders that you need to address, so you need to come up or invent. That's why I asked you guys to cover yours, an ROI number. But what they want to hear is that you've got a solution to a problem that keeps them awake. What is the C-suite mind share capture approach? And that is either it's a problem that's keeping me awake at night, or it's an opportunity that I'm not sure how I'm going to capture. And if you can tell me that you understand my industry, my sector, my firm, down to firm level, and you can say how you're going to do that, you've got my attention, and you've got the possibility of an engagement that you wouldn't have if you just came in and talked to me about ROI, because that's... So the second thing I'm going to say is incumbent workers, incumbent workers, incumbent workers. The formal workforce investment system has few, if any, resources. We once had more. We now have almost none for addressing incumbent workers. The vast majority of workers we're going to have 20 years from now are the workers that we have now. The vast majority of people that are going to be our incumbent workers are not going to go through prolonged periods of unemployment. They're not going to be, and when they do go through that, they're going to be in a work-first mindset. You know, that's not an investment mindset. But when you want to talk to employers and engage employers, if you can show value, and this is something that a lot of the national fund sites have done, and others in the sector business, right, Jack, is address incumbent worker issues first. It demonstrates value. It addresses these kinds of issues that are the C-suite's mind share, and it gets everybody in an attitude now, let's see if we can increase the scope. And ultimately, when we're in an economy, frankly, where robust growth is far away from our imaginations even right now, the way we're going to get openings is moving people up. It's the suction approach. So incumbent workers is a strategy for job seekers to get opportunities.
Just a couple of questions or quick comments on that. I mean, the issue of how do you deal with incumbent workers, how do you deal with the different clusters and sectors that exist in all of our communities, I think really is up to our members to decide at the local level. And so what we find is a lot of experimentation going on, a lot of different ideas. Just to mention a few, in Indiana right now set up a regional work councils where they address career and tech ed in the high schools. They retool the curriculum to address the talent pipeline, change how career and tech ed is taught. Maryland is building a bunch of industry strategic partnerships. They're giving out grants. First grant for $4.5 million just went out in that community to look at where the needs are. Colorado's moving down into really creating communities of interest that have different needs and different ways to deal with that. Texas has a thing called a reality check program, again, looking at how you build the talent pipelines. And so they're trying to build interest in what the different jobs and the skills that are needed mostly among individuals who are trying to enter into the labor markets. And so they build a number of systems that provide information about the realities of the workplace and help them decide what kinds of skills they should go into. Connecticut has a lot of money on the table in two different projects in manufacturing, advanced manufacturing. They have a number of major programs going on there. So largely what we're finding is, as you guys are discussing your models and what's going on in some really exciting areas, a number of most of our members are looking at their local communities and trying to decide how to engage. But I would add one other thing. You know, as we talk about all of these wonderful models and how they work, you know, the real issue is we always talk about is going to scale. And so you have the partnerships and you have the funds and you have just really good examples. But, you know, you've been around for a while and we've done this, you know, we've done this for a long time. And we've got lots of good examples. And Mark talks about return on investment and how you get the employers engaged and how to create what that really might be and what the effort that they put into it is going to return to them. But if we look at what's happened over the last 10, 15, 20, 30 years, we've had lots and lots of innovation. We've had a sea change, I think, in the attitude of folks about how to create partnerships and who should be at the table. We've learned a lot about those partnerships, but we're still talking about, you know, a lot of individual programs. And until we can get that to scale and understand how to finance that and how to bring everyone together, we still have a lot of work to do and a lot to learn.
Well, hospitals for quite some time have been doing a number of things, some more traditional. Most recently, we've started trying to be a little more innovative about it because we've realized that if these workers are going to be in demand and we're going to be here to take care of patients, then we're going to have to be a little more proactive and maybe aggressive in doing that. So the traditional ways that we've recruited healthcare workers really started in middle school with candy stripers, we call them junior volunteers now. So that was a way to introduce young people into the healthcare profession, and many of them ended up being nurses or physicians or other types of healthcare workers as a result of their experience working in a hospital. They found it very exciting and a nice opportunity. Most hospitals provide tuition reimbursement for employees who are interested in achieving a higher level of skill or a new degree that's related to healthcare. We also provide scholarships to many employees who, and our auxiliary, which is our volunteers, also do that as well to help our employees, and we give them the time off and the resources in order to be able to pursue advanced education in healthcare. One of the things that we're seeing a real movement on, and I'm not going to make a judgment about it, but there is a concern related to diploma RNs and BSN RNs. Currently, a diploma RN goes to school typically at a community college for 2 years, takes the same nursing exam as a 4-year degree nurse, and working in a hospital will make the same amount of money and that sort of thing if they're at the bedside. So there's a movement to try to elevate and limit the number of diploma RN programs, which is great because I think that RNs to have a 4-year degree is probably appropriate, but it also is going to really push on the availability or the supply of RNs, and there are many positions that RNs hold in hospitals, particularly at the bedside for the less critically ill patients that probably can be cared for with a lower level of RN. So that's a concern that we are working on pretty diligently. Our recommendations are to target programs in post-secondary education based on employer surveys that are done through state labor departments, and I think we've heard some good examples of that today because we know where we're going to have a shortage. We know where we have a shortage today. What we need to do is try to mitigate that demand as much as possible over the next few years. And then I also mentioned about licensing standards. Every state has different licensing standards for different skilled professionals in healthcare. And many times it's the state licensing boards that don't want to relax the standards because they're trying to protect the profession. But it really exacerbates the problem when you have a skilled professional that is required or no one else can do the things that that person is doing. We are seeing some relaxation of those requirements, particularly related to physicians and physician extenders through advanced nurse practitioners, but there's a lot more that could be done where the physician actually supervises highly skilled nurses rather than provide some of the care directly. Technology is another huge area that is definitely transforming healthcare delivery today. And so making sure that our healthcare workers have the technology skills in order to be able to meet the needs in innovative ways so that patients can access care. Things like using Skyping rather than requiring a patient to come into a physician's office, using their iPhones to manage their blood pressure and other conditions and submitting, and that information is transmitted today already back to hospitals where nurses are monitoring that so they can make sure that patients are staying healthy so they can stay out of the hospital. Those are the sorts of things that we're going to be training our employees on and looking for employees that have those skill sets. And then the last thing I want to mention is a program that we recently uncovered it's by the Council of Adult and Experiential Learning. They have a Career Lattice program where they're educating home health and certified nurse assistants so that they're getting on-the-job training because of these new requirements and the credentials and the other skill sets that home care aides are going to need since it's going to be such an exploding demand. Also, apprentice programs for a number of different types of skilled workers. Again, the challenge that we're seeing are licensing boards who are very reluctant to do something that's not it's more traditional. They are relying on the tradition rather than looking at new ways to make sure that patients can access care.
Wonderful. I know I appreciated all of those responses, and I hope that everyone in the audience did too, and therefore I'd love to open it up to the audience.